Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today we're looking at precision medicine. We know that it can lead to better outcomes for patients, but the complex processes and lengthy turnaround times associated with biomarker and molecular testing can be challenging for community cancer programs. As cancer centers are finding new solutions to streamline and improve precision medicine processes, one way that has proven successful is through the introduction of a precision medicine steward role. Our guest today explains this role known as molecular processor. We'll find out how the role came about and get tips for cancer programs interested in implementing a similar program. Here with us is Melissa Cruz-Tanner. She's the manager of patient navigation and molecular processing at Astera Cancer Care in East Brunswick, New Jersey. Nice to have you here, Melissa. What happened that made your center begin the process of standing up a molecular processing department?
Sure. So when I joined Astera, I actually joined as a general LPN with the possibility of becoming a patient navigator. So the molecular processing wasn't even up for discussion. It was generally just to create a navigator program for the practice as it was growing. And we saw that navigation was really big nationally in the medical home for the patients. So, as part of my navigating, which is coordinating the care for the patient, testing, visits, part of that was seeing where we could improve the connection between access to care and the overall function of the office. That's when we realized that molecular processing was such a key item in determining treatment for the patient, access to care. And when we were reviewing the charts of the patients and through my initial experience with Astera, it was kind of like, okay, this is a need for the practice. We need to improve this to get a better outcome for our patients.
What did it take to get approval and administrative buy-in?
Wow, considering what it took a lot of data collection. We had to literally quantify every step, the time that it was taking for the orders to be placed, the time that it was taking for us to follow up, even something as simple as uploading a result from the portal. So once we allocated all that data and we showed the practice, okay, the front desk is doing this, which isn't really their primary role. The lab medical assistants were assisting with this portion of it. That really wasn't part of their role. We said, what better way to handle all this than actually creating a team that was primarily focused on order execution, processing, and then the follow-up of those orders. And at first they were a little apprehensive because, it's always good to think of the financial aspect and how to run a practice, right? And seeing if it's financially feasible. And when we looked at this data and we said, okay, if we take all these extra tasks from the non-collaborative departments and we put it all focused on one team, that allows them to work at their maximum capacity. And then it allows the molecular team to really focus and be more hands-on with the needs of those tests, each individually, and making sure that everything is a very streamlined approach. So when we get the results, it's all without a hitch.
How has this role helped your patients?
So in essence, in the beginning, when a patient comes into the office, they're all explained you're going to get some form of testing. The period of wait time causes so much trauma to the patients, just the anxiety of not knowing. With us implementing the molecular team in our practice, it allowed us to have a realistic timeline on when we could tell the patients the results would be in. It would also allow us more diversity in test selection. If we knew that a particular vendor guaranteed results in 10 days, but it was so time sensitive for us to decide treatment because of the stage of the patient, we were already aware we can transition to a different testing format that would give us a result in 7 days, thus cutting the time and access to treatment. So it improves the overall patient experience.
What was the biggest challenge you faced implementing this role?
I think the biggest challenge is really showing the initial value of the idea of creating a molecular team. We're always thinking about what is the most cost efficient way for us to be able to provide care in a sound manner. And collecting all that data was the biggest challenge, is really seeing how involved the process was. And we had no idea initially. We saw it as something as simple as completing a requisition form and kind of leaving it to the lab to process the rest, but it's so much more involved. And I think once we collected that data, proving the value of this team, proving how much more efficient it would be in something as simple as treatment decision making, that was the biggest challenge, is allowing them to see our vision. But ultimately, our leadership was very open to growth and evolving, and they were, quick to jump on board.
Thank you, Melissa. Head to the show notes to find out more about precision medicine stewardship and the evolution of this new role. If you're enjoying this content, make sure to check out the Cancer Buzz audio podcast channel. There you'll find frequent episodes that provide a deep dive into the latest trends and issues in cancer care. Just search for Cancer Buzz on your favorite podcast app or ask Alexa to play the Cancer Buzz podcast. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.